Hope your week is off to a good start. You're watching Ari랑tV's special coverage of COVID-19. I'm Min Sun-hee. A relentless rise in infections from overseas is fueling concerns over containment efforts here and debate over the medical costs of treating foreign patients. We have more on that later on the program. Here first are the latest numbers on the pandemic with our Kwon So-ah and related economic news with our Yoon Jung-min. So we had a rather turbulent weekend. How are we starting the new work week?
Right, Sunny, a turbulent weekend indeed, and that due to many cases from abroad, and that including Russian sailors as well as South Korean nationals who returned from Iraq on Friday. So perhaps we should start by taking a look at our graph here. Now, today's number stands at 25 new cases. That's pretty similar to what we had last Monday, but then we had that exponential surge to the 3 digits on Saturday, and then the next day we had a drop by around half. So again, as of 12 a.m., the number stands at 25 new cases, and that brings the total to 14,175. We have one additional death, raising the death toll to 299. 971 people remain in quarantine, while some 12,905 people have made a full recovery from COVID-19 here in the country. Now let's move over to our map. We have 9 new cases in the capital Seoul, 6 in Gyeonggi-do Province, and 1 case each in Chungcheongbuk-do and Chungcheongnam-do provinces, as well as 1 down in Busan. Meanwhile, 7 cases were detected at the nation's airport or seaports, and out of the 25 new cases we have today, 9 were local cases and the other 16 were imported cases.
Now, so speaking about imported cases, they are a major concern here, and especially given the worsening situation overseas. We're connecting to a resident in South Africa later on the program. I understand the country there is reporting more than 10,000 cases on a daily basis.
Exactly, Sunny. South Africa's cases actually account for around half of the African continent's cases. So let's take a closer look at the major outbreaks here. South Africa here, as you can see, is the country with the 5th highest number of infections in the world, with over 445,000 cases and some 6,700 fatalities, and that as South Africa added more than 11,000 new cases in a day. Now, no change here in the order in the top 3 countries, the US, Brazil, and India, but there is a change here down in Mexico, which now has more than 390,000 cases, which means this country has surpassed Peru now. So let's take a look at Peru, over 379,000 cases with over 18,000 fatalities. And with that, let's take a look at the total number of cases abroad. We have a total of 16.4 million now and 652,000 fatalities. Meanwhile, the recoveries have now surpassed the 10 million mark. And those are the updates I have for now, but I'll be back after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. The COVID-19 pandemic has rattled financial markets across the globe, but in recent days, major US stock markets have started recovering from the huge losses recorded back in March. This trend is also visible here in the local market. For more on this, I have our Yoon Jung-min here in the studio. Welcome, Jung-min.
Hello, Sunny.
So, Jung-min, how are markets here and abroad faring?
So, right, so markets remain volatile, but when you take a look at the general trend over the past couple of weeks, well, stock markets are rallying since it bottomed out in March. You know, as we all know, the U.S. economy still seems to be stuck in recession, but IT giants like Google, Apple, Amazon, Microsoft, they are leading the Nasdaq rally. So ever since the Nasdaq closed above the 10,000 milestone for the first time last month, it has been breaking record after record. The Dow Jones Industrial Average and the S&P 500 are also emerging clear from a bear market witnessed several months ago. These days, investors are buying stocks on high hopes for the development of COVID-19 vaccines. Also, it seems people are anticipating more fiscal stimulus packages from the government as well. Here's what an analyst had to say on recent market trends.
The trading action resembles the market leadership that we saw coming into this COVID-19 pandemic and what we've seen throughout it, which is really to say that investors continue to favor the true growth companies. I mean, you see the Nasdaq stocks outperforming.
Now, as for the South Korean markets, the benchmark Kospi has broken above the 2,000 mark. The tech-heavy Kosdaq has also been erasing huge losses posted back in March. According to data from Korea's bourse operator last week, more foreign investors returned to the Kospi market this month. They have purchased major IT shares, including those of Samsung Electronics. Foreign investors net purchased over $1.3 billion worth of Samsung shares until last Tuesday.
Right, Chongmin. It also appears that retail investors are buying more stocks. Please tell us more.
That's right, Sunny. So more young and tech-savvy investors are flocking to the stock markets these days. In the U.S., a number of people have started making investment through the mobile app called Robinhood. As of May, Robinhood had 13 million accounts, which is more than double the membership pool it had last year. And its users include a large number of people in their 20s or 30s. Even when markets were crashing due to the coronavirus outbreak, Robinhooders were still buying stocks. But some point out that they tend to invest in penny stocks or near bankrupt companies. Analysts say it's dangerous and risky to ignore poor corporate fundamentals when making an investment. Here in South Korea, more young people are also looking for bargains and scooping up cheap shares. Retail investors have been flocking to biotech, healthcare, and pharma stocks, and they also tend to prefer short-term investments. Take a listen.
Despite a sharp decline in stocks, retail investors are hoping that the markets will swing up again based on their past experience. This has contributed to the market rally.
In fact, South Korean financial authorities are closely monitoring this short-term investment trend. Deputy Finance Minister Kim Yong-bop said earlier that the influx of retail investors adds more liquidity to the market, but at the same time, this could increase market volatility.
Is there a concern of a possible bubble forming in the market, Chongmin?
Well, unfortunately, there are, because some experts fear that the markets, the current market trends are maybe overheating, because as we know, the COVID-19 situation in the U.S. is barely showing signs of easing, slowing down. As we all know, it's adding a huge number of daily new infections. And if we fail to control the outbreak, experts say the markets could just take a nosedive collapse again at any time. And we currently have a rally, but it could be fragile, and it all depends on how fast they control the virus. Also, in addition to high volatility in the markets, experts are also keeping a wary eye on U.S.-China tensions. The world's two largest economies are still locking horns over trade issues, and their ties have soured even further this year due to the COVID-19 pandemic. Also, the U.S. economy is not doing so good. Last week, after the release of the company's second quarter earnings, JP Morgan CEO Jamie Dimon sounded a warning, saying the U.S. simply don't know what will happen next with their economy. Still, jobless rates are high, and a number of businesses are still suffering from the pandemic. That could be another risk factor for the markets.
Right, but I'm sure investors are hoping not to see the kind of crash we saw back in March.
Definitely, because it was very bad. Wall Street and global stock markets, they have seen some of their worst nightmares in many decades. The markets were quick to respond to the WHO's official declaration of a pandemic for the first time on March 11th. The next day, the Dow Jones Industrial Average plummeted almost 10%, while the Nasdaq and the S&P 500 both plunged more than 9%. Wall Street saw an even bigger meltdown on March 16th, with all major three stock indices posting double-digit percentage falls. This was their worst day since Black Monday in 1987. European and Asian markets were also hit hard. In March, for the first time since the 9/11 shock in 2001, a circuit breaker was activated on South Korea's Kospi market because of sharp losses.
All right, that was a wrap of COVID-19 on global financial markets. Chongmin, thank you for that coverage.
It was my pleasure.
Right, it's time now for the regular government briefing on COVID-19 here in Korea. Much concern was raised this past Saturday following news of 113 new infections, the first time in 4 months for the number of daily cases to hit above 100. Officials had earlier on Friday warned of such a possibility given the rise in cases on a Russian ship in the port city of Busan and the return of Korean construction workers from Iraq. From the 113 cases on Saturday, that is, the infections, 86 of them were imported. But on a slightly comforting note, yesterday, that is Sunday, as our Kwon-Seol reported, the number of daily infections dropped to 58, with imported cases standing at 46. 6. In response, authorities have revealed intentions to look into the possibility of requiring foreign patients to shoulder the financial burden of treatment, which on average stands between 3.3 million to 70 million won, depending on the severity of the symptoms. And this is an issue we are poised to discuss later on in our studio session. Meanwhile, local authorities are transforming parks and shaded areas under bridges into places of relief from the sweltering heat for the elderly. Local communities have installed temporary cooling devices at these venues with strict social distancing guidelines in mind. Now, prior to the pandemic that is, local community centres had been converted into cooling areas for senior citizens during the summer. But given the warnings against confined and congested indoor spaces in recent days, and amid the rise in infections of COVID-19, officials are looking to turn these areas, outdoor venues and large indoor spaces with proper ventilation and enough spacing into these cooling centres. We are still waiting for that briefing to commence, and perhaps while we do, we can take a look at today's numbers. Now, I've just heard that the briefing is about to start, so we'll come back to you with the summary with our consul later.
Let us now begin our regular briefing for the COVID-19 situation here in South Korea. As of July 27th, we have 9 new local infections and a total of 16 new imported cases. And the accumulated number of confirmed cases now stands at 14,175. A total of 15 more people have been discharged, so that means 91% of the total number has been discharged, and a total of 971 people still remain in quarantine. The number of patients with critical conditions decreased to 14, and we had 1 additional fatality, and the death toll now stands at 299, with the fatality rate at 2.11%. I extend my deepest condolences to the deceased and the members of the bereaved family. Here are some major updates on our domestic infections. Related to the Gangseok Central Daycare Center in Gangseok District, Seoul City, we have 3 additional cases. In total, we have 28 cases that have been confirmed to date. In relation to an office building in Gwanak District, Seoul City, we have 1 additional case. In total, 38 cases have been confirmed. And in relation to the Personal Information Protection Commission at Seoul Government Complex Building in Jongno-gu District, 14 people are on self-quarantine, and we have conducted the 57 people who were tested, and among them, all of them tested negative. And today we have 16 new imported cases, and 7 of them were identified at the points of entry, while the rest 9 have been reported during their self-quarantine. 9 people were South Koreans, with 7 foreigners, 1 from the US, 1 from Belgium, and 4 from the Philippines, 3 from Iraq, 3 from Russia, 2 from Kazakhstan, and 2 from Hong Kong. And as for the South Korean nationals who returned from Iraq, we have 2 additional cases testing positive, and a total of 76 people have been tested positive. And during the last 2 weeks, here are some updates on our quarantine measures. During the past 2 weeks, we have looked into the sources of infection. 62.2% were imported cases, while some 22% were the local transmissions, and 40% are currently under investigation. And on average, on a daily basis, we had 19.2 average on day increase, and this is decreasing steadily. However, centering around metropolitan area, we are seeing cluster infections continuing, especially at the elderly facilities as well as military units. And by age, we have seen a decline in the number of people in their 50s, while those in the 20s and 30s increased to about 39.8%. In total, we had 4 fatalities, and 3 of them were in their 70s and 1 in his or her 80s. And the fatality rates, as for the those in the 80s, has about 24.1%, while on the 70s were about 9.5%. And most of these fatalities were related to the door-to-door facilities in Daejeon and Gwangju. And also, there are also a case under investigation, and we have witnessed that there is an increase in the number of fatalities in relation to the door-to-door sales. The KCDC, we are exerting our full efforts to curb the further spread of the virus, and starting from July 20th, we have resumed the opening of the elderly facilities as well as social facilities, and we have some precautions. And as for the managers of these facilities, first, please disinfect the shared objects, including doorknobs and wheelchairs. Second, please refrain from activities that increase the droplet infections, like singing, and please disperse the time of having meals together, and please refrain from talking while you are eating meals. And as for the workers who are working at these facilities, you could be a grave risk to all of the users as well as other members in the facility. So if you have suspected symptoms, please do not go to work, but rather get tested as soon as possible, and refrain from going to multi-use facilities like clubs and singing rooms, and please refrain from going to small gatherings. While you are working, please wear protective equipment like masks, and please wash your hands on a regular basis. These social welfare services users also need to take precautions. If you have suspected symptoms, please do not go to these facilities and get tested as soon as possible. Within the facilities, please wear your face mask and wash your hands, as well as other personal hygiene measures. Next, we have some updates on our imported cases. During the past 2 weeks, we have seen an increase on the number of imported cases. On average, there were 30.4% people. On average, this was about 11% increase from the 2 weeks before, and this shows a global trend of an increase in the number of global patients. And we have designated 6 countries as high-risk countries. And also, we are exerting our full efforts to curb the further influx of imported cases. Up until now, as for the high-risk countries, we have restricted the visa issuance as well as the regular flights. And we also decreased the passenger flight capacity to below 60%. And also for all of the foreign entrants, we also mandate them to submit a PCR negative document within 48 hours of departure. And as for the number of confirmed cases coming in from the foreign countries, those from the Philippines has decreased slightly. However, from other 5 countries, they have increased. And starting from today, as for the foreign entrants, they need to get tested on about the COVID-19 on the day of entry, and also before they are discharged. So there are 2 times of testings. And recently, we have seen a wide cluster infection stemming from the Russian flagship that has docked in South Korea. And we will continue to carry out on quarantine measures. And we have been testing all of the sailors and workers, whether they are Koreans and foreigners, starting from the July 6th. And we are also having a special care on the Russian flagship, and all of the sailors are getting tested upon their arrival. Going forward, in order to curb the further spread of the COVID-19, we will expand the number of high-risk countries. And as for the sailors who came from these countries, they need to submit a PCR negative document within 48 hours of their departure. And also, we are talking about the issues of shouldering the burden of financial cost of the medical cost for these foreign entrants, and they will be also carried out going forward. The KCDC also continues to stay vigilant as we have the upcoming summer holiday season, and we ask you to refrain from going to crowded places, and especially also the cafes as well as restaurants that are located in the tourist destination. So this year, we ask you to be relaxed and enjoy your vacations in a relaxed form. If you are going on a holiday, please shorten your stay and also go in small groups, particularly with family members. And please refrain from going to closed, crowded, close contact environment and wear your face masks at indoors. So please also remember the 3 do's and 3 don'ts that you need to also comply with. First, here are 3 do's. First, when you are indoors, please wear your face mask. Please minimize your stay time at resting places as well as restaurants, and also keep 2 meters distance or at least a meter distance with each other. And also secondly, we also have 3 don'ts. If you have symptoms of fever or respiratory symptoms, please do not go to these vacation spots, and please refrain from going to crowded places, especially at crowded time of the day, and please refrain from physical contact and activities that increase respiratory droplets. Recently, we have seen a size of the COVID-19 spreading through local communities dwindling slightly. However, we are still witnessing cluster infections in the metropolitan area. To this day, the KCDC, we have seen that there are several risk factors of COVID-19. First is the global trend of the COVID-19, which is increasing the number of imported cases here in South Korea as well. As we have mentioned in the briefing, we will be expanding our countries of high risk, and we will minimize also the visa issuances, and we will also continue to curb the influx of imported cases. Second risk factor is the upcoming summer holidays as well as summer vacations. As we've seen in the early week of May, we believe that this could lead to a possible large cluster infections as it did with the Itaewon Club case. And also, we are fearful of possible cluster infections through retreats and also large-scale holiday seasons. And we believe that this is the first summer holiday and summer vacation after the COVID-19 outbreak, and we ask for you to always remember the importance of safety of yourselves as well as your families. Please always comply with the 3 do's and 3 don'ts that have been mentioned before. COVID-19 spreads especially at closed, crowded, close contact environment. It is also accompanied with high infectious risks, so please avoid these areas and always wear your face mask and wash your hands on a regular basis. The third risk factor is the protection of health of the elderly citizens. Starting from last week, we have been resuming the operation of social welfare facilities, and thanks to the management, we also are going through a safe resumption, and we continue to ask for your participation as well. And we are also fearful of possible cluster infections and sporadic infections, especially centering around door-to-door facilities, which is also leading to fatalities as well. And against the COVID-19 outbreak, we ask you to refrain from going to these facilities. Thank you very much.
Right, that was Chung Kyung, the head of KCDC, with Monday's afternoon briefing. So do give us a summary of the key announcements.
All right, well, let's take a look at the imported cases, which have been a rising concern these days, and that's why the government is now going to strengthen the quarantine measures at airports and seaports, including whenever foreign entrants come into the country, they have to be tested twice now, beginning today. So even after before they're going to be discharged. And also also, there have been 2 additional cases linked to the construction workers who returned from Iraq. We're talking about South Korean nationals. 2 additional cases bringing that total to 76. And during the past 2 weeks, it looks like 62% were imported cases. So that's something we have to be vigilant about.
I see. All right. So thank you for that. We'll see you again tomorrow.
See you tomorrow.
A comprehensive study published in the medical journal The Lancet concludes that mask wearing greatly reduces the risk of COVID-19 infection. In fact, the proper use of face masks can reportedly curb chances of contagion by more than 85%. We share details in this next report.
It's important not just simply to wear a mask, but how you wear the mask is important as well.
I'm going to give them some suggested guidelines.
It all starts with choosing the right type of face mask for a given environment.
When you're not in a confined space or a closed space, or if you don't have any people around, you could probably wear the dental facial mask if you have trouble breathing, but in other circumstances, you should definitely stick to the N95s. It has something to do with the fit of the mask. Normally, the N95, they are snug fit, which means it fits right to your nose. And the particles, so-called droplets, which carry the virus, cannot enter the filters of the N95 from the outside.
So there's little doubt that N95 certified masks are the most effective when it comes to protecting ourselves from COVID-19. But for certain age groups, N95 masks can have adverse and even life-threatening side effects.
The problem with the infants is that they cannot express if they are having a hard time breathing, so they have a higher chance of suffocation. You should always know that their airways are much smaller than the normal adults. My recommendation is that if they don't have to wear a mask, they shouldn't have. And if they do have to wear a mask, you should check probably once every 30 or at least 40 minutes to make sure they are breathing okay.
So once you've got the right type of mask that suits your age and environment, what's the correct way to wear one?
The first step is to wash your hands with soap and running water or sanitize your hands with alcohol-based sanitizer. Secondly, you want to open your mask, put the rings around your ear, make sure you get a good seal at your nose and also around the mask.
Once you've taken off your face mask, you should never touch the outer surface of the mask, even if you have already washed your hands. Otherwise, you could be exposing yourself to contaminants that could find their way through your eyes and nose when you touch them with your hands. Also, rather than pulling your mask down to your chin, it is better to take them off altogether.
You do not want to have the mask hanging off your chin. The reason why is because the contaminants in the front of the mask can then very easily go into your nose or into your mouth, and so that's really the wrong way to wear a mask.
At the present time, there is no clear way to make disposable masks as good as new after they've already been used. If you need to stretch your limited supply of masks, then keeping yourself clean while using them remains the only option for the time being. There are certain times when you have to take off your masks, such as in restaurants, cafes, and bars. So how can you keep your mask clean when you're not wearing one?
So you do not want to touch the front part of the mask. Use the earrings to remove the mask, lean forward slightly, and without touching the front of the mask, remove it. After you take your mask off, to store the mask, you want to place it either in a clean plastic bag or in a place that has good ventilation, or if you have to place it on a surface, make sure that you place it with the surface, the outside surface, on top.
Don't forget to wash your hands and never touch the outer surface of your mask. If it is done right, mask wearing can be a reliable way to protect yourself and those around you from the risk of infection.
We turn our attention now to South Africa, which reportedly accounts for more than half of the confirmed cases in that continent. As of this Monday, South Africa has well over 440,000 infections and stands as the fifth worst hit country in the world. For more on the situation there, I have Karabo Seleke live on the line. Hello, Karabo.
Hi, Sunny.
Now, in recent days, daily highs in South Africa have been hitting well above 10,000 cases. What is the reason for the rapid rise and how severe is the situation there in South Africa, Karabo?
Okay, so in South Africa, we are currently under a national lockdown. Our lockdown started in March and we were at level 5. So at level 5, only essential workers went to work and everyone else had to stay home. So as we progress down the levels, the economy opens up, meaning more people are going back to work, learners are going back to school. So obviously, as there's more people returning, our cases have gone up.
Karabo, I understand changes in funeral practices to stem the possible spread of COVID-19 have been deeply traumatic, that is, for South Africans. Could you elaborate, please?
Yes. So under level 3, only 50 people may attend the burial. So night visuals have been bad and we need to practice as much physical distancing as possible. So as a result, some people have had to resort to streaming funerals live on Facebook, on YouTube, to accommodate the people that could not attend. It is very tough that we can't be with our loved ones during these difficult times, but this is the sacrifice that we need to make to curb the spread of this disease. And as South Africans, we are very resilient people, and we've been through a lot, and I know that we can get through this too.
Right, Karabo. Now, you are a teacher by profession. How is the pandemic affecting, that is, the academic arena in South Africa?
Yes, so we went back to school in June, but we couldn't have everyone back. So we only had the grade 7s and the matrics, and then the other grades would alternate. We had to adjust the timetables, so we have to screen the learners before they enter the school and when they leave, and then also practicing social distancing in the classroom. So it has changed a lot, but we are trying to practice social distancing at school.
Right. Karabo, what efforts have been adopted by authorities there to tackle the outbreak, and what is perhaps the most urgent issue at hand?
Okay, so especially at school, kids will be kids. They want to, hug each other. They want to share their lunch with their friends. But, we need to monitor that they keep their distance from each other. They don't yet fully understand how infectious this disease is, but there are strategies in place. We have to wear our masks all the time. We sanitize regularly, practicing of social distancing.
All right, Karabo, thank you for sharing your thoughts with us at this hour, and do stay safe.
Thank you, Sunny.
해외유입 외국인 환자에 대해 입원 치료비의 전부 또는 일부를 본인이 부담하도록 하되 외교 관계를 고려해 상호주의 원칙을 적용하겠습니다.
Foreign patients with COVID-19 here in Korea may soon be asked to pay for the medical expenses involved in their treatment. Now, this measure comes as part of efforts to address the potential burden on the country's medical infrastructure, given the surge in imported cases in recent weeks. For more on this, I have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
And I also have Dr. Sean Kim from Korea University. Welcome to the program, Dr. Kim.
Thank you.
Right, Dr. Kwok, this past Saturday, as I said earlier on, we saw 86 imported cases. What do you believe is the reason for this surge? And is this reality a threat to our current containment efforts here in Korea?
Well, I think it could be the biggest worry that we could have for the time being. It's not so much of how much control we can take within the country, but it's really coming from the outside that we have no control over. I'm not able to actually blame the countries for creating such many cases because it's already begun and it's already happened. But we have to pay very close attention to how we're going to mitigate the incoming influx of the newly case numbers and possibly prevent further secondary or tertiary infections that might happen from the overseas, from the case numbers from the overseas. But in regards to that, I also believe that our government is actually taking quite a very good action. As you've already seen, our Minister Jung already has mentioned that we're going to step forward and make people self-quarantine for 2 weeks, but at the same time, we're going to have them get a test in the beginning of the quarantine and also at the end of the quarantine, so to make sure that they are negative when they're let out to the society here. But also the fact that before their departure to our country, they are supposed to have a COVID-19 test that tests negative within the 48 hours of frame before boarding on the plane. So I'm pretty sure that all these measures that we're currently taking would suffice for mitigating the influx of the numbers, hopefully.
Right, and despite that, because of the concerns over the rising numbers of imported cases, there are growing calls here for the government to better address this scenario. What are your thoughts on that?
Right, I might have answered somewhat part of the questions already, but it's really the best that we're doing currently. We can't really mandate everybody to be tested for their third time or fourth time once they're in. It's also impossible for us to actually block everyone out who can possibly be or be not be suspected of the COVID-19. So at the current measure that we're currently taking, I believe it will do quite well. But also the fact that we need to probably pay more attention to how we're going to block secondary or tertiary possible infections once there is a miscalculation, let's say, and then somebody slipped out and started infecting others in Korea. So maybe additional extra measures that we could possibly take are paying more closer attention to, let's say, elderly gatherings and elderly places, nursing homes, for example. So those sort of interconnections that we could possibly prevent, and I think we'll be doing much better.
Right, because the elderly, of course, are much more vulnerable to the virus.
Exactly.
Dr. Kim, it takes on average about 6 million won to treat a patient of COVID-19, and foreign patients here in Korea, their medical expenses are also being fully covered by the government. Is there a legal basis for this coverage?
Well, if you actually look at the numbers, 80% of the cost of treating a COVID-19 patient is actually paid for by the National Health Insurance Corporation. That's the public insurance that covers South Korean citizens. And the remaining 20% is actually divided between the national and the provincial governments. However, if you look at the foreign cases among COVID-19 patients, it's a little bit of a different story because the national government actually pays for the entirety of the cost. Now, the government's hand is actually tied on this because they are actually required to do so under a law called the Law for the Prevention of Infectious Diseases. I know that this is where a lot of the public anger comes from, that Korea is indeed being turned into a COVID-19 refuge, and we have to literally, per expression, pay through the nose. But there is actually a legal basis, and Korean government is simply following the law as it's been laid out.
I see. So if you were a Korean national and you happen to be overseas and you happen to be infected by COVID-19, your expenses for treatment too would be paid by the country you're residing in?
Yes, in some countries, yes.
And is this still the case in quite a number of countries? Could you give us the scenario there?
Well, if you look at other countries, there's actually there's another international protocol called International Health Regulations that was created by the WHO, the World Health Organization, and I believe, if my memory serves me correctly, Article 40 of the International Health Regulation actually says the state party shall not charge a foreign citizen for, I believe, the protection of protection of public health. Well, the thing is, sorry about that. We took a look at. I actually took a look at about 21 countries related to this issue, and there were about 8 countries who actually do pay for the entirety of treating foreigners with COVID-19, and such countries include United Kingdom and Australia and Malaysia, for example. However, the other 13 countries that I've looked at, they only do so for long-term foreign residents, or they don't do it at all. So if you're Korean and you're infected with COVID-19, you would be treated in full in certain countries, and but not in other countries. So it's basically country by country. But if you are in a certain country, there are actually countries that actually pay for foreign COVID-19 cases. So to charge that Korea is becoming some sort of a financial refuge for COVID-19 is a little bit unfair.
I see. Dr. Kwak, I understand, though, that there is a favorable aspect in providing free tests and free treatments to both nationals and foreigners alike with regard to preventative measures. Mm-hmm. Do you agree?
Yes, I do. Because it's sort of a driving force for people to feel free to come and be tested, because they would be worry-free even if they're confirmed of the case, that they would be assured that they could just be admitted free of charge or very minimal charge, and they would be taken care of by the government. It's also, I've actually seen in clinical settings that a lot of these people, especially in the cases with regards to Itaewon cluster infections, because my hospital is located very near. A lot of these contact people who came into contact with confirmed cases, they felt very much free to actually come in and be tested, not just because they were worried for their possibilities of infections, but more so because they did not have to worry how much they would have to pay for the test, and once they are confirmed of the case, how much they would have to pay being admitted. So I believe it's very much of a strong driving force for the government to mitigate the spread of the case, but not only that, but also to trace possibly already confirmed cases.
Right. Dr. Kim, speaking as a layman, I ask you whether such assistance to these foreign patients here in Korea, do you see it as ultimately affecting national coffers?
Actually, the short answer is no, because as of July 27th, if my memory serves me correctly, we have had 14,175 cases here in Korea. But of those 1,175, only about 762 are foreign nationals. That only represents about 5.4% of the total cases. So it's not like we have hordes of foreigners, flocking to Korea for free medical treatment. However, I believe the government is actually worried about the offhand chance that because foreign COVID numbers have been increasing quite quickly in the past month, that it might overwhelm medical infrastructure here in Korea. And the new regulations that they're talking about is partly a precautionary measure should such an eventuality come to pass. However, let me go back to the short answer again. Foreigners coming here and being tested and being treated for COVID-19, does that represent some sort of a medical financial crisis for South Korea? No.
All right, well, that's good to know then. Dr. Kwak, what was the situation like during the MERS and SARS outbreaks?
So I looked back at some symbolic cases of MERS cases and SARS cases, especially those happened in foreign countries. I believe there was this one very symbolic case where a Korean national was diagnosed with MERS in China. The big news about that was that the Chinese government actually took care of all the finances for that patient. And I also believe that those cases that happened in Saudi Arabia, those were also taken care of by that kingdom. So even in the past, even though the case numbers were quite different from what we are currently having globally, a lot of the confirmed cases overseas were taken care of by their own governments, due to their locations.
I see. Dr. Kim, what are perhaps some of the diplomatic factors that need to be considered with regard to the treatment costs of foreign patients, do you think?
Well, when it comes to diplomacy in international relations is all about perceptions. And although it's not entirely intentional, South Korea's response to the COVID-19 crisis has actually had the effect of raising South Korea's global profile. And that means in other countries, South Korea is seen as a country where things are more or less under control, that the country is not descending into chaos or having its medical infrastructure being overwhelmed by the crisis. And but in that regard, once South Korea actually starts charging foreigners for COVID-19 treatment, it might actually give the impression to the other countries that maybe South Korea is feeling the strain of the COVID-19 crisis. Let's posit a hypothetical situation where a South Korean national is being treated in another country free of charge, whereas South Korea is charging a foreign COVID-19 case. And that actually creates a problem with, number one, reciprocity, and number two, with international protocol. Now, the biggest international protocol regarding this out there is, of course, the international health regulations by the WHO. And according to the WHO, yes, foreigners do have to be treated. And if South Korea actually starts charging foreign COVID-19 cases, it might be seen as a breach of international protocol, and such breaches of international protocol, even if the IHR is not enforced as strongly as other agreements, such breach of protocols is never good for global perception.
So there's much to be considered then.
Yes.
All right, Dr. Kim, thank you very much for your thoughts. And Dr. Kwak, as always, thank you for being with us today. Right, well, we say goodbye on that note. Do tune in tomorrow as we touch upon the global debate on universal basic income amid the pandemic, since it's fueling a lot of hardships, that is. In the meantime, Ari랑tv welcomes your thoughts and inquiries through our social media accounts or homepage, arirang.com. Thank you for being with us.
Daily social distancing. The goal of daily social distancing is to prevent the spread of diseases while carrying out daily business and social activities. It consists of preventive measures for individuals and for communities. If you are ill, stay at home for 3 to 4 days. Maintain a distance of 2 arms length